Welcome everybody to today's webinar on patient and family engagement, promoting effective strategies for transforming your practice in partnership with patients and families. My name is Christine Bechtel. I'll get started with some introductions here in a second. But most of you will know about the Patient-Centered Primary Care Collaborative, which is a terrific nonprofit organization that is working to promote collaborative approaches to primary care improvement. And one of the centerpieces of their work in that effort is the Support and Alignment Network, which is our context today, where they're really promoting a collaborative approach to improving person and family-centered as well as clinician and community-centered strategies for engagement. So I'm Christine Bechtel, as I mentioned, and I'm joined with by my partner, Jennifer Sweeney. Both of us are experts in patient and family engagement. We're going to talk about that today. And our company is called X4 Health, and it's a purpose-driven organization that is dedicated to accelerating the quadruple aim in healthcare, which means better health, better care, lower costs, and also better experiences, not just for patients and families, but also for clinicians and staff. So we do a lot of work across the country on patient and family engagement. And the thing that we like to do as the first step is to really define what we mean by patient and family engagement. We find that people have a lot of different definitions, and so that's where we will start today. Then we're going to talk through the value case for patient and family engagement, hopefully give you some compelling reasons that you should adopt this strategy in your own practice, and give you some practical ways that you can use patient and family engagement strategies as soon as next week. So let's start by getting on the same page in terms of the concept patient and family engagement. It reminds me a little bit of those Volkswagen commercials in the 70s and 80s where they talked about Fahrvergnügen, and it was, sort of this generic term. You'd say, well, what does it really mean? And people would say, oh, it's what makes a car a Volkswagen, of course. Yeah, but what does that really mean? And so patient and family engagement sort of experiences a similar trend, if you will, and it's one of the barriers to really doing effective patient and family engagement in practice today. And we think we can remove that barrier by really getting on the same page. And so we developed a common framework for patient and family engagement that I'm going to show you. It has 3 levels to it, and we're really grounded in a definition of patient and family engagement that focuses on how people, their families, and their representatives, as well as healthcare professionals, are really working in an active partnership across various levels of the healthcare system to improve both health and care. And those are 2 different things. But this definition was developed in collaboration with some researchers and other scholars who helped look at the landscape of the evidence and best practices in the field and really derive this approach that reflects a new and different way, an expanded way, a more multifaceted way of doing things. And it has 3 levels, as I mentioned. So the first is patients and families being partners in direct care. So this is how most people think about patient and family engagement. We think about how do we expand people's capacity to get and stay well. So that's the concept of self-efficacy. The second level is system design and governance. How are we actually collaborating with people and their families, consumer representatives, and others to guide change and to shape ongoing operations? So this is really about being partners, having patient partners involved in redesign efforts. And these 2 levels are where we're going to spend most of our time today. There's a third level, though, as well, which is policy making. And so, if we think about healthcare, it's a very different sector of the economy than, say, consumer electronics, right? Just the laws of economics are a little bit different when it comes to healthcare, and it's very influenced by policy making, right? So what do the laws say? Lots of regulations in healthcare. So if we have that environment, it makes sense that patients, families, and consumer advocates should really be part of influencing those policies that are so driving healthcare today. So let's also, talk about the fact that patient and family engagement has been called the blockbuster drug of the century. There's lots of buzzwords, lots of talk about it. There are actually many requirements, speaking of policymaking, in the macro law that we're going to talk about in a second, but also in the Affordable Care Act. I mean, really, patient and family engagement got some huge traction starting back in 2010 with Affordable Care Act provisions that required that in the creation of these new models of care, new delivery models, new payment models, the secretary actually has to demonstrate that people and their families were engaged in care and that these models resulted in better outcomes for them before the secretary can replicate them on a national scale. A lot of people don't know that, and I mention it because it's a really critical centerpiece that's helped create a real business case for patient and family engagement in practice today, and it is really essential to a lot of new models of care. CMS just issued its first person and family engagement strategy very recently, so they're obviously very focused on it as well, and it is critical to success under the quality payment program, and this is, of course, the program that was created by MACRA. So when you think about the quality payment program, particularly MIPS, the Merit-Based Incentive Program, there are many quality measures that are driven by practices' ability to successfully implement patient and family engagement, patient experience measures, medication management measures, functional status measures, conducting advanced care plans. All of those, and those are just a few examples, are quality measures under MIPS. Second, of course, you guys know that MIPS has multiple components. Advancing care information is one of them. That's the health information technology piece for really meaningful use. So things like patient portals and e-prescribing or patient-specific health education really are also great examples of patient and family engagement. And then finally, you'll remember that I talked about patient and family engagement in redesign. MIPS has a ton of examples where clinical practice improvement activities are those things that really invite and welcome patients in as partners in practice transformation. And there's a lot of evidence that Jennifer's going to talk about momentarily that tells us that this really is an accelerant and a more effective way to implement clinical quality improvement activities. But you can see that in the MIPS program, they make up 15% of the score and in fact include things like advisory councils or assessing patient experience, conducting shared decision making, and importantly, involving patients in quality improvement programs. So patient and family engagement also totally essential to APM performance. This is the other arm of MACRA, right? We know that when it comes to performing well under advanced payment models, that performance is reliant on better outcomes, lower cost, better patient experience, patient loyalty, right? If you think about ACOs, you really need to have patients who are attributed to you and who stay within your system voluntarily. And coincidentally or not, what the evidence tells us is that patient engagement also leads to better outcomes and lower costs, as well as better patient experience and more satisfied clinicians and staff. So there's a beautiful marriage here and a potential to leverage patient and family engagement to achieve better performance under APM. We also know that patient support is really essential to embracing new payment models. We don't want to repeat the consumer backlash that we experienced under the HMO model, where we were really too focused on cost maintenance and not enough on health maintenance. And so here, involving patients in developing and assessing these new ways that we're delivering care is another way that we can guarantee the success of new payment models as well. So, I'll leave you just with a few thoughts before I hand it off to Jennifer. One is that you guys have seen the TCPI patient and family engagement metrics, and you can see them on the screen now. So ranging from supporting patient and family voices, that's the redesign element that I've been describing, to health literacy and medication management and patient activation. But I don't want you guys to think, oh, here's a random collection of engagement metrics, yet another set of things that we have to do. It actually makes sense that these particular things are put together, and they work synergistically with each other. So the example that I will leave you with is hypertension. You can imagine if you want to improve hypertension control, you could convene a group of patients, maybe it's a mix of patients whose blood pressure is under control and those whose blood pressure is not under control. And they might help you select a patient activation tool so that you really have the best chance that the tool will work for patients, that it'll work for your staff, that you can put it in your workflow in the right places so that you get patients to complete the surveys with the least amount of staff resources. You can imagine using this group to help you figure out, what patient education or shared decision-making tools would be the most useful to them and used by them. What are the most efficient ways to engage in shared decision-making? Maybe it's even through your patient portal or it's a standalone strategy, but you know that you also need to give patients their own health information. You can do that through the portal. It's going to be really essential for them to have their medication list and blood pressure readings. So now if we're giving patients more access to their own health information, it might make sense that we also pay attention to their ability to use that health information in the form of health literacy. And then, of course, everybody knows that medication management is completely essential to, well, most conditions today, frankly, but certainly people with hypertension who use medication as a strategy for control. So these metrics are really a great example of how engaging patients in their care can work in harmony with engaging patients in practice redesign and lead to some really outstanding results. So that's the sweet spot between care and redesign. And Jennifer, I'll hand it to you.
Great, thanks, Christine. And I'm just going to advance the slides. Okay, great. So thanks so much for walking us through the metrics. I think one thing to include here is that not only are these metrics interconnected, but the evidence tells us that these pathways, like the one that you just described with hypertension, lead to improved quality of care and patient outcomes, more engaged patients and better satisfaction, not just for patients, but for clinicians and staff as well. So the bottom line that I want to make sure I emphasize in today's presentation is that delivering care in ways that involve patients and families actually accelerates performance. And the other thing I want to make sure I emphasize is that this patient and family engagement work doesn't have to be complicated and it doesn't have to be expensive. So let's look at the first TCPI metric, which is involving patient and family voices in your practice. So let me say first that I've worked with a lot of different practices around the country, and one of the things that I find is that there's this misconception that the only way to involve patients and families is to create a patient and family advisory committee or council. And I want to make sure I say that that's not actually true. In fact, I actually don't recommend starting a council or a committee as a first step, because there's lots of different ways to engage patients and families, and it really comes down to choosing the option that fits best with, one, your practice's timeline, two, what you're trying to achieve, and three, the resources you have within your practice. So I'm going to run through some of these options just to give you a sense of the kinds of things that you can be doing with patients and families. So for example, the first here, patient surveys. Surveying your patients is a great way to get a sense of what patients are experiencing in your practice. Now, some of you or many of you may be gathering patient experience data for performance measurement and public reporting. In that case, you need to go through a third party to make sure the data is valid or meets certain guidelines. But you don't need a third party to survey patients as part of your own QI efforts. So as long as you have emails for the patients in your practice, you can create a quick and easy survey on SurveyMonkey and send it out to them. The key with patient surveys, and you're going to see this throughout all of these options, is to take the feedback you get from patients and use it to improve the ways that patients experience your practice. So focus groups are another great way to get input from patients and families, and they're really going to work best for you if you're looking at care for a specific population of patients. Say, for example, you're focused on care for patients with diabetes. I would recommend bringing in 7 or 8 patients, have a conversation with them and your team, and you can ask them to share their experiences with care. Encourage them to share any challenges they have in managing their diabetes. Ask them to offer ways your practice can support them in managing their health. I often find that having people into the practice and talking over lunch is a great way to get to know patients and also really to help them feel comfortable having these conversations with you and your team. So order some food, have a conversation over lunch. The third option is ad hoc ways. So For example, your practice manager can give patients an index card before they leave the office and ask them to share one thing that went really well in their visit and one thing that they would change. Ad hoc feedback is not just a good way to get general feedback or input from patients, but you can also use it for a specific area that you're focused on. So maybe you're looking at how patients are making appointments. So you can ask them things like, tell us your experience with making appointments. What's working for you? What's not working and needs to be changed? So advisory councils, I talked about that a moment ago, and that's really another option for practices in terms of trying to bring and involve patient and family voices into your practice. And, you know, I've worked with a lot of different practices around the country, many of whom have created patient and family councils, and they say to me, listen, you know, this is one of the best things I've ever done, and my only wish is that I had done it sooner. So I think there are lots and lots of benefits to creating a patient and family advisory council. I just want to mention that I think the best success with a council comes with practices that have a staff person on hand who can really manage and work closely with the council. And then it's also, I think, really important to make sure that you have several projects that you can work on in the near term with patients and families. So just don't, you know, create a council to create one. You want to make sure that you have work coming up really, you know, in the short term that you can partner with together to make a real positive impact in your practice. So, for example, maybe you're thinking about revamping your welcome packet for new patients. That's a great project to do with a council. Or maybe you're thinking about changing the setup in your waiting room. That's another really great opportunity to work with a council for a period of time to make sure that you're involving patient and family voices in your practice. And then last but not least, PDSAs and quality improvement projects are another great engagement strategy. So, for example, if your check-in process for new patients is taking too much time, maybe your team has come together and said, you know, we want to do a quick PDSA on this and figure out what's happening. My advice would be to invite 2 or 3 patients to join your team, sit down, and figure out a way to simplify things. So the patients, they could actually do a mock run-through of what new patients do at check-in. And they can work with you to share ways the process could be changed to be more efficient. So maybe it's streamlining forms or reformatting them to make them easier for patients to complete. The patients that you invite to work with you will help you figure out what works best. So before I move on to the next slide, I think the most important thing here is to choose an approach that works for you. And to remember that working with patients and families doesn't have to be complicated. I said it before, but I want to just really emphasize that what it boils down to is talking with patients, talking with family caregivers about their experiences, and then using that feedback in your QI work. So let's look at another one of the metrics, which is using an e-tool that both patients and clinicians can access to share information. And this metric is a really great one for engaging patients and families, and you can do it with whatever strategy that works best for you from the ones that I just shared on the last slide. So, and I also want to point out that I think this engagement can work whether you have a portal now or whether you're thinking about implementing one in the future. So here's what you want to do here. One, you want to ask patients and families what they like most about the portal that you have or what they would like to use the portal for if you haven't implemented one. And then ask them their biggest challenge with the portal, or again, if you haven't implemented one, you know, what would be the biggest barrier to enrolling in the portal? The goal here is for you to get information that you haven't thought of or ideas that you haven't had access to before. And I say this because in my experience, I've seen so many practices contract with a third party to, you know, bring in this e-tool only to find out that it's not accessible or useful to patients. And I really, you know, I want to make sure that that doesn't happen to you all. So before you invest in an e-tool, talk to your patients. Or even if you already have an e-tool, you and the patients in your practice can work together to get the most out of it by, you know, understanding what patients need and want from an e-tool, and then also what your practice could benefit most from with an e-tool. I know in my experience, I worked with a practice in New Jersey. They were struggling because no one was enrolling in their portal. So they asked their patients what was going on, and what they found was that registration was really tricky. And the practice itself had no idea that registration was tough because, the vendor they had contracted with walked them through the registration process, and that kind of information and tour, if you will, didn't really filter down to the patients. So ultimately, the practice created a flyer, and it had, step-by-step instructions. They put it in the waiting room with a computer for patients to use, and enrollment skyrocketed. So I've also included this case study here. Something similar happened with this practice. They were struggling with their patient experience scores, especially when it came to lab test results. And they worked with their patients to figure out a better way to deliver those lab tests. And not only did their patient experience scores improve, but the number of patients who called the office for lab results decreased. And so, I know for all the practices I work with, that's a real win-win. I mean, who doesn't want decreased call volume? So the takeaways here are, 1, choose the engagement option that works for you and your practice. And 2, integrate patient and family engagement into your existing priorities and work. And we'll talk about that a little bit more later in the webinar. So before I end, I just want to make sure that I share with you 3 top keys to success, to successful patient and family engagement, because I really want this to work for both you and your team and the patients in your practice. So first, it's important to get everyone in your practice on the same page with what patient and family engagement means. And this goes back to what Christine shared at the beginning of the webinar. There's the 2 levels that Christine talked about, engagement in care and engagement in redesign. So you want to just make sure everyone in your practice is working from the same understanding of what patient and family engagement is. Second, I think it's really important for everyone to understand that patient and family engagement is a strategy. It's a way to get your work done faster and more effectively. So it's not sort of like this check-the-box activity. It's a strategy or tactic. And that's because engaging patients in design means you have another set of hands and ears and another pair of hands, or another set of eyes and ears and another pair of hands to rely on as you work toward your practice's goals. So patients can help you identify useful patient education materials. They can give you suggestions for ways to make your waiting room more comfortable and welcoming. They can offer feedback on your phone tree to cut down call volume. And engagement care is the same kind of thing. Patients who are partners in care, they follow through on advice and on care plans, and as a result, you as a practice have better outcomes, which is good for you as a practice, but also good for them as patients. Third key to success, start small. So I think what I have found is that it can be tempting to try and take on numerous things at once when it comes to patient and family engagement. And what I've seen to be most effective is to start small. So you want to plan, you want to implement, and then you want to assess what worked and what didn't work. And this is actually not on the slide, but I want to make sure I just share this last piece of guidance, which is if what you're doing isn't working, that's okay. Stop and try something else. Patient engagement is only truly successful when it works both for you as a practice and for your patients and families. So with that, I'm going to thank you all for being here today. We've really enjoyed sharing some tips and strategies for effective patient and family engagement. And we just like to encourage you to reach out to us if you would like help integrating patient and family engagement into your existing quality improvement work. I've included here the email addresses for Christine Bechtel and myself at x4health.com, and we encourage you to reach out to us at any point. We'd love to work with you. Thanks so much, and have a great rest of your day.